और इसको ऑन कर दो पहले। आपको स्क्रीन शेयर स्क्रीन का है वो काम हो रहा है। Hi everybody, can I try a sharing screen please? Whoever is the host, can you allow me to share screen?
Yes, ma'am. A very warm welcome to all. It's a wonderful day and I, Maulikalsha, feel privileged to extend my warm welcome to all presented here. On behalf of Pragyan Foundation, promoter of Pragyan International University, Ranchi, Jharkhand, in association with the Global Academy and Lions Club of Kolkata, Harmony, on the occasion of World Health Day. Just a little housekeeping before we get started. To keep the quality of sound functional during the presentation, please mute yourself. At the end of the webinar, we will share the feedback link. After filling the feedback form, you all participants will get e-certificate in your mail ID. Now, without further ado, we will turn the time over to our guest speaker, Dr. Neelam Mohan. Dr. Neelam Mohan is one of the most popular pediatric gastroenterologist and liver specialist in India. She is a skilled pediatric endoscopist and was one of the first few to start therapeutic endoscopy work in infants and small children in India, a recipient of prestigious B.C. Roy National Award by President of India. Dr. Neelam Mohan is director of the Department of Pediatric Gastroenterology, Hepatology, and Liver Transplantation at Medanta, facilitated by Health Minister by Andhra Pradesh at alumni meet of Osmania Medical University. Being the first woman from Osmania Medical College to receive the B.C. Roy National Award. Dr. Neelam Mohan is one of the few doctors in India who has balanced the various pillars of the medical profession and is appreciated as an astute clinician, healer, bright teacher, researcher, efficient leader, administrator, and for her contribution in social work. She has, to her credit, many achievements that has put the country on global medical map. May I now request Neelam ma'am for giving your valuable insights on obesity in Indian children.
Thank you. They had muted me, so I was not able to do it. I will just give me 1 minute. I'm just trying to get these slides done. Email me, Dala. So at the onset, I would like to thank you all for this beautiful opportunity to me. And the subject that I chose is so important, which talks about obesity and overweight in children. This is becoming like a real big epidemic. We have talked about COVID and deaths, and today I want to enlighten you that the issues with air pollution and deaths in children are much more than even COVID. And the issues with overweight and obesity in children are also very huge. So our, how will I refresh? Yeah. मैंने आईटी वाले को कब से बुलाया हुआ कि नेट का इश्यू आ रहा है। I told them that you're very responsible. नहीं पुराने. This is the नहीं वो यही है, यही लेना पड़ेगा. इसको बंद कर दो ना. ये कह रही है क्या कहाँ है? गलत वाला है. नहीं आएगा. ये बंद करो ना. It's not like that. You will have to the क्या ये क्या super वाला. So embarrassing. Correct है. Okay, share screen. सेकंड स्लाइड करो तो आपको दिख जाएगा. How do I share screen? इसको बड़ा नहीं करना. नहीं, but how do I go back to this? Am I able to share the screen? I'm not able to share the screen. Give me 1 minute. How do I go back to this? Why did it go in the कोने में क्यों चले गया ये? Can the host allow me to share the screen? There is some problem. कैसे करें?
Hello, ma'am. Yeah, you can share the screen. We are already seeing your screen. You are allowed to share the screen. You can unmute yourself and you can share the screen.
एक तो unmute. How to increase this? What did we do? How did it go there? Okay, it says stop share. So now I'll have to share. And then, did you open that? One. And this नहीं होगा. इससे share इसी से हो पाएगा because वो खुला नहीं. Then how do I do it? Where is it? यहाँ पे है ना? Okay, then I open this and I go to share 1 minute. And let's go share. Is it showing now? Hello?
It is not showing yet.
No, madam.
Okay. Share screen. I think I'll just share this, whatever that is. Is it showing now?
Yes, it is showing.
Yes, now it's appear.
Okay, sorry about
Great.
that. And so what I wanted to say today, thank you. So what we learned is that nothing is difficult when we say. So just like today, when we want to lose our weight, It sounds almost impossible to lose weight, but just like the efforts we made, we can always reach there. So I don't know who are my audience. Are there any teachers, any parents who are the audience? I'm sure there are various people. So just to get you an idea that 39 million children under the age of 5 years are overweight, and 340 million children and adolescents 5 to 10, 19 years are obese. So we parents, when you talk to them, they never ever come to a doctor saying ki mera bacha mota hai, that is, my child is overweight. They never ever come, and they take overweight and obesity and they call it as my child is healthy. So first of all, that is a wrong word what they are doing. It is not the child is healthy. They should understand the child is unhealthy. So that is one thing you need to understand. One, it is preventable. You can only correct it once you know that there is a problem. And with parents, there is a denial in overweight. They can't believe a patient is overweight. Unless the patient is obese, they don't understand. But the sad part is, in India, we were always talking about undernutrition. And here comes, we've gone into a state where there is a dual malnutrition. Ek taraf undernutrition and dusri taraf rampantly our children are getting overweight and obese. And average data which is coming from school children is shocking. 1 in 5 children, 20%, is getting obese. So this is the problem of India with this obesity. How do I diagnose obesity? We take BMI. So BMI is the body mass index, is based on weight, and after 2 years of age. So we have some growth chart which all of you as parents and teachers should know, that all pediatricians, all doctors, when you go for a child checkup, if your doctor is not maintaining a growth chart, he or she is not a good doctor. The doctor has to make a growth chart. Without a growth chart, you will never understand where you are. And the thoughts is, Bhagwan hame doctor se dur rakhe. That is such a horrible thinking, because if you go to a doctor for prevention, you will not end up with problems in life later on. And most of the problems, whether it is heart problems and obesity problem, liver problems, which you see in adults, are starting in childhood. So if you want to prevent the main diabetes, heart disease, fatty liver, all that in adult, you have to start working on children. So children are not only the future of India in terms of economy, but in terms of health. So which is in your hand, and you need to understand that how we take the cutoff. We take less than 2 years weight for height. So height ke hisab se weight kidhar hai? More than 2 years, we take weight by height square BMI. So this is just to tell you that jaise normal BMI is 18.5 to 23. Overweight is 23 to 27. I may look very good to you, but unless I check my BMI and my waist circumference, you will not know whether I'm overweight or not. So I will talk about that. And obesity is when your BMI is 27 above. And extreme obesity is more than 35 or 35. So these are changed now that you see. These are the growth charts which you use in children. See that your the doctor is maintaining the which are different for girls and boys, and we call them IAP, Indian Academy of Pediatric chart, which came in 2015. And these charts will tell you that because the world ka charts, growth charts and all, may not be very useful for Indian children genetically. So these charts are that. Now with BMI, sometimes you cannot take into account the pot belly. All people who are sitting here, you may be surprised that if you take the waist circumference, they are very big, because we Asians, we Indians, we tend to get fat in the center. You have to do a lot of workout. I work a lot to ensure that the
See the screen, but we cannot hear you.
can you hear me?
We can hear you now.
Okay, so what we want to talk about is that even in we need to look into the waist circumference. We need to look what is weight, and that this is a special machine which tells you about your weight in various parts of the body. And I want to today tell you, if your child is fat at 6 years of age, 50% of them will become adults fat. If your fat child is obese at 14 years, 80% will be obese there. So you see, it is the responsibility of the parents, mother, parents, to, if you want a beautiful future India, your parents didn't work on you. Now you work on your children, because if you don't work on children, they will become obese later on. So this is a key message for you that you want to understand. How do you get obesity? Some is genetic and the rest is environmental. Environmental is your lifestyle, your eating, your exercise, and air pollution. All this are giving large meals, food variety, snacks, eating outside. All these are the various problems that have come. Television, computers, sedentary lifestyle, depression, all this because of that. Children, they go on overeating, they don't exercise. These are the problems why you are facing obesity in children. Also, if the child has not received breastfeeding, and if the child was born preterm, these children have a high tendency to become obese. So breastfeeding is very important if you want to prevent. Genetic predisposition, yes, everything is not genetic. But if you have genetic, then you need to work even more to make sure that you don't get obese. This is a vicious cycle. A child first starts seeing the TV, video games, and is studying all the time. Because of that, the child gets overweight, not very fat. He gets overweight and he feels little shy. He or she doesn't want to play with other people. He gets more weight. And once he gets more weight, people start teasing him. Children don't want to play with fat people. They say, "Tu to hamari team mein nahi rahega, tu mota hai, tu bhagta nahi." So they throw him out of the team, and because he's out of the team, he's not playing, and he gets further overweight, and this becomes like a vicious cycle, which the parents need to understand. That is the key message I'm saying, that preterm children and those who don't take breastfeed, they do. If your child is overweight and short, please consult a doctor, because there can be some endocrine hormonal problems in them. If your child is tall and obese, then it is more likely due to lifestyle problems, and you need to work in these children as simple obesity. What are the side effects of obesity? Blood pressure is higher. When you go adults, you get blood pressure. Your lipid profile in children get bad, so you will get heart diseases. Orthopedic is more in children because of this. Diabetes in adults is because of overweight in children and obesity. Ovarian disease, women not getting pregnant, again because of obesity. And the gallstones are more, liver problems are more, asthma is more, sleep apnea is more. Your in the night they snore and they can drop and they can die in the night. Obese people can have a subtle death without knowing. Your brain becomes slow because the cognition level decreases, and your behavior is irritable because nobody wants to play with you, they teach you. So acidity problem is more, constipation problem is more, pancreatitis problem is more. Sadly, cancers are more in overweight people. So it is not only adults, but problem in obesity. 1 in 5 children are obese and overweight. So please understand that these problem, fatty liver, which we are seeing, is a part of metabolic syndrome, diabetes, insulin resistance, high cholesterol. All these are problems, and fatty liver is also because by 40 to 50 years, Indians are needing liver transplant, and because fatty liver, they are needing liver transplant. If you work in children, you can prevent this fatty liver in adults. See this liver slide. On the left side was just fat, but the patient did not take care. It became in the middle. It became even worse. Scarring started. Once scarring started, the right side by adult, they became cirrhotic. If they became cirrhotic, then they want to get transplant. India, urban population is very bad. Not only urban, even in Kashmir, rural centers, they are very fat. 1 in 3 children in India, liver disease is rampant. I'm a liver doctor, so I'm talking about when the overweight, obese children come and I screen them, 30% out of the overweight have bad liver already, and 15% have scarring, and that is how they get this hit, and secondary hit, they will get into bad problem. Another thing I want to say is, sadly, like in Delhi and other countries, air pollution. Newer papers are showing because of air pollution, children are getting obese. Obesity is also secondary to pollution, bad eating habit, sedentary, less playing, more screen, more TV. All this is making a problem. You need to work on them. If they lose 10% of the body weight, the liver and other functions will improve. So for tomorrow, if you want that children should not develop diabetes, they should not develop liver disease, blood pressure, cholesterol, heart disease, please don't shy away. Get the growth chart. Understand, even if they are 3 kg more weight, for a 20 kg, 3 kg is more than like 10%, 7%. Take it like that. Don't think it is only 2-3 kgs more. Worry when they get overweight. Otherwise, you will have problems. The way the country is moving, it is going to be a major problem that you're going to face in this country. Thank you. I will take questions now.
As Dr. Neelam has said, if anybody has any question, you can please ask.
मेरा बोलने से कुछ सीखा है क्या? कुछ समझ आया? क्या समझ आया? मुझे यही बोल दो, क्या समझ आया? म्यूट करो और बोलो की पॉइंट्स। 10 की पॉइंट देने हैं। बच्चों में ओवरवेट बढ़ रहा है, बच्चों में मोटापा बढ़ रहा है, मोटापा बढ़ने से उनको ब्लड प्रेशर की बीमारी, कोलेस्ट्रॉल लिपिड की बीमारी, जोड़ों की बीमारी, डायबिटीज की बीमारी, लिवर की प्रॉब्लम की बीमारी, हार्ट की बीमारी, ये सारे प्रॉब्लम्स हो रहे हैं। माँ बाप कहते हैं मेरा बच्चा हेल्दी है, मगर उनको बोलना चाहिए मेरा बच्चा मोटा है। पहले एक्सेप्टेंस करो, डोंट आई अवे, डोंट नॉट नो। जब तक ग्रोथ चार्ट नहीं देखोगे आपको पता नहीं चलेगा बच्चा मोटा है। तो डॉक्टर के पास जब जाओ तो ग्रोथ चार्ट से देखो। थैंक यू फॉर अप्रिशिएटिंग। काफी मैसेजेस आ रही हैं, मगर आज का मुद्दा सिर्फ मेरे से पूछो कि मोटापा कैसे हम बचाएं, उसका आंसर मैं अभी दूंगी आपको। 40 मिनट्स इंटू 2 टाइम। बच्चों को सिर्फ पढ़ाई करके कुछ नहीं होगा, बिना मेंटल हेल्थ के, फिजिकल हेल्थ के, सिर्फ विद्या से नहीं प्रॉब्लम होगा। आपको बैलेंस रखना होगा। 1 आवर इन अ डे प्ले का, सारा टाइम स्क्रीन टीवी। मेरे पास बच्चे आते हैं, एजुकेटेड अनएजुकेटेड पेरेंट्स के भी, बस वो मोबाइल लेके बैठे रहते हैं। स्क्रीन के लिए। सो मोबाइल, टीवी, लैपटॉप, कंप्यूटर, इससे ब्रेन का डेवलपमेंट खराब हो रहा है, मोटापा बढ़ रहा है। प्लीज आपको इन सब से दूर, ऑडियो सुनो, स्टोरी सुनो, पढ़ाई के इसमें डोंट पुट ऑन द स्क्रीन। खाने में वेजिटेबल ज्यादा खाओ, सब्जी, वेजिटेबल, फ्रूट। क्या घी तेल से मोटा होता है? नहीं, मोटापा मीठी चीज से होता है। स्वीट्स एंड कोल्ड ड्रिंक्स, सॉफ्ट ड्रिंक्स, जूसेस, इन सब से मोटापा बढ़ता है। घी खा सकते हैं लेकिन फ्राइड चीज नहीं खाना, मीठा नहीं खाना, स्वीट, शुगर्स नहीं खाना, ये चीजों से मोटा होता है। सब्जी, रोटी, दाल वाल, इससे मोटा नहीं होते, लेकिन एक्टिविटी करना जरूरी है। चले, आई थिंक एवरीबडी एंजॉयड द टॉक। घर जाके सब अपने बच्चों का वेट लेंगे, हाइट लेंगे। मोबाइल में वेट हाइट डालने से एज के साथ आपका बीएमआई आएगा। उनका बीएमआई 23 अडल्ट्स का है, उसका इक्वलेंट हमको ग्रोथ चार्ट पे करना होता है, तो बच्चों का डॉक्टर करेगा। देखिए अगर है तो उनका मीठा बंद कर दीजिए, चीनी बंद कर दीजिए, वेजिटेबल, फ्रूट्स दीजिए। रोटी चावल दाल से मोटा नहीं होता है, मीठा से, फ्राइड से मोटा होता है, वो बंद करें। And thank you, organizers, over to you.
Thank you, ma'am, for giving your valuable insights
एक-
about
एक group
obesity in
photograph ले लीजिए,
Indian children.
एक group photograph ले लीजिए।
Okay, ma'am. And we have come to the end of the webinar. We would like to thank everyone who made this webinar possible, and I thank you all once again. Dr. Neelam Mohan, we want to facilitate you with a certificate of appreciation. Thank you a lot, ma'am.
Thank you. Let me take the photograph of your
Yes.
certificate.
We'll
Let me
send you
take
the
the photo.
certificate by email, ma'am.
Okay, bye-bye.
Now, all the participants, please.
I will unpin myself so everybody's photograph
All
you
the
can
participants-
take.
No, ma'am.
All the
Gallery-
participants, please check the chat box for the link of the feedback form. We'll share it in some time. Please take the feedback form and get your e-certificates in your email ID. You will get the sample participation certificate. We'll show you in 1 minute. Just a second. We'll send you the feedback link. Just a second. You please fill up this feedback form and you will get your e-certificates in your email ID. Thank you everybody for participating in today's webinar. We hope to see you soon in our next webinar, which is on Friday, 8th April on emotional intelligence at the same time. We'll share the registration form in the WhatsApp group. And you can, I think we can share the participation form. Yeah, this is the form.